This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, I have a follow-up question from Carol. She says, how can patients improve their chances of successful IVF outcomes, especially when dealing with conditions like PCOS or endometriosis? And then another question from Jen.
Okay, obviously, pre-existing problems need to be dealt with as much as possible before going down the IVF route. If you have significant endometriosis, for instance, I think the evidence is swinging much more in favour of a laparoscopy and removal as much of the endometriosis as possible before you undertake an embryo transfer. I say that because in that format, because a strategy is to actually create the embryos and then have your laparoscopy to deal with your endometriosis and then put the embryo back. It's thought that the big problem with endometriosis is the environment in which the embryo is placed. The endometriosis in some way interferes with the uterine environment. So by minimizing the endometriosis, you can then put the embryos back that you created earlier. And that's becoming a more common strategy. The other reason for doing it is that if you have severe endometriosis that involves the ovary, any surgery to remove endometriosis of the ovary has the potential to damage the ovary and your ovarian reserve, and i.e. the number of eggs might be less and therefore reduce your chances of success with IVF, which is, as I've said many times, is a numbers game. The more eggs you get, the more chance you have of getting a pregnancy. So endometriosis, that deals with that. In relation to PCOS, there isn't very much to change if you're going to have IVF and you've got PCOS. It's a good sign in some senses, because almost always women with PCOS will get lots of eggs, and therefore their likelihood of a pregnancy is going to be good. The things, however, that go along with PCOS and are things that you can do something about is excess body weight. Many women with PCOS, particularly the severe cases, are significantly overweight, and we do know that weight is related to IVF success. The lower you can be, it seems that even if you're only losing 5 to 10 kilos in your lead up to your IVF cycle, you can improve your chances. You don't have to lose 30 kilos, but a loss of body mass is useful. Really, all the other things in relation to improving chances of IVF are pretty debatable. Obviously, smoking is a bad thing, and it does reduce fertility rates. But that's a long-term problem that just stopping it probably is not going to make a huge difference, but we still recommend stopping. In relation to diet, there's no evidence that any particular diet is better than any other diet, despite claims all over the internet with and Dr. Googles all over the world saying this diet, that diet, but the evidence is not there. Other things you can do, being as fit as possible is probably good, but again, I wouldn't start running marathons just because you're having an IVF cycle coming up. So preparation for an IVF, dealing with medical conditions is important. Thyroid disease, for instance, it's good to have be stable, because once you're pregnant, that's going to be very important from the baby's perspective. Other preparation, it's important to have folic acid on board, because in early pregnancy, spina bifida is more common if you have low folic acid levels. I'm not a great advocate of multivitamins. Most women in our society eat well. They have their veg, they have their meat, they have their fish, they eat fruit. That's going to give you all the vitamins you need. And spending a pile of dough on multivitamins, really, I'm unconvinced it makes any difference. The only important one is folic acid.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey Podcast from the navigation menu.